Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today, we're going to be talking with Tricia Carroll, an occupational therapist and certified hand therapist at Bradley Whiteside Rehabilitation. Tricia has been an occupational therapist for over 25 years. She works with people who have a variety of diagnoses like stroke, tremors, numbness, tingling, or orthopedic concerns, including fractures, pain, and weakness. She treats infants to older adults. Bradley Whiteside Rehabilitation Center is located at 1225 Broderick Drive in Dalton, next to Bradley Wellness Center. Tricia, thank you for joining us today.
Thank you so much for letting me be here with you.
Tricia, can you tell our listeners what exactly is a certified hand therapist?
So certified hand therapist is one who has had an advanced certification that shows an expertise in any treatment for the hand and upper extremity in relation to their function. To get to that point takes quite a bit. You have to have at least 3 years of experience and 4,000 hours of work experience with the hand and upper extremity just to qualify for taking the certification exam itself. It's a fairly prestigious honor to have that certification and to be able to provide that treatment. And in real life, in actual treatment, once we obtain that certification, our main focus is anything in the upper extremity, so anything from shoulder down to the fingers.
Do you typically treat patients that have had surgery?
Some have, and some have not. We can see conditions prior to surgery, sometimes just to prepare them for the surgical process, and then after the surgery, we will continue that therapy with them to get them back to their maximum function. There are some that never see us until after they've had surgery.
Right.
And then there are many conditions that we have that come into the clinic that they never even are candidates for surgery. And therapy is able just to take care of the needs that they have and being able to discharge them back to their home just to continue with a home program to maintain the function that we've gained.
Are there certain medical conditions that are commonly treated by a certified hand therapist?
There are. In general, we can cover anything, again, from the arm, like in the arm, from shoulder down to fingertips. That may just be as simple as like a weakness, and that could be from some type of sports injury or a work-related injury, or just from all of our little heroes who get out and work in their yard and get a strain or tendonitis from working, and they'll just feel some pain and weakness. Carpal tunnel is actually another diagnosis that we see a lot of, and people think that that has to be related to their work function, but that's not always true. So even if you're not working for a specific employer, but you're starting to have a tingling and numbness in your fingers or pain in your hand, a visit to the local physician to be diagnosed with carpal tunnel is helpful, and we can do some therapy interventions to help that diagnosis without actually having to have the surgery for it. We also see a lot of patients who have tendonitis, and we see different areas of that. It can be in the shoulder, the wrist, the hand, and a lot of times we will see tennis elbow or golfer's elbow, and patients will come in talking about those issues. But what it boils down to is just basically an inflammation in the tendon or muscle, and the patient's just basically feeling pain. And then as a result of that, as that prolongs itself, then they may have some weakness or limited range of motion that we need to address as well. Fractures in the shoulder, elbow, arm, or hand are also another area that we would be helpful. And also for arthritis, we see a lot of arthritis in the hand. At the base of the thumb is the CMC joint, and we see a lot of patients who are really limited in their daily activities, even as like being able to cut an apple or prepare dinner for their family is a struggle because of the pain there. And we use a lot of our techniques to be able to help them manage that pain and discomfort.
For our listeners, if they're coming to hand therapy, what would they expect a typical treatment to be like?
Okay, so when you first come into the clinic, we're going to do an initial evaluation with one of our therapists. And this is just one-on-one time to do an interview with the patient, kind of see what the history has been in relation to their pain and their problems with their function. And then we're going to actually tailor a specific exercise program or therapy program for that person. Sometimes it is just with exercise alone, and then other times we may be using some of our special machines to kind of address pain and inflammation that we can do in the clinic. After the initial evaluation, typically patients will be seen 2 to 3 times a week, and their treatment may vary between 30 and 60 minutes depending on the needs of the patient.
Right.
Exercise is definitely a large part of of our treatments, and this may be to work on movement and gaining range of motion, or may be focused on addressing strength or endurance. In hand therapy, we also look at a lot of fine and gross motor skills, especially in fine motor skills with the dexterity and movement of small objects in the hand. And we use a lot of manual techniques as well that may include soft tissue massage and mobilization to address any tense muscles, decrease pain and tightness, and promote healing in the musculature. We also offer splinting, which is kind of a unique portion of our department and for hand therapy. So we actually use a thermoplastic material to make your own cast, so you'd say. And that's very tailored to you, and it's a little better than having to go to a local store and just pick up one off the shelf, because you don't really know if you're small, medium, or large.
Right.
So ours, we were actually able to melt that down and actually form it directly to you.
Good. That is a great thing that you're able to actually melt that down so it fits your hand perfect.
Yes. It makes me think that all that arts and crafts as a kid has actually paid off as an adult. And we're able to have some fun in the treatments too.
That is great. Hey, tell me about the team that you have over, the team of therapists at Bradley Whiteside Rehabilitation.
We're very lucky to have 2 CHTs on staff, myself as well as Randy Word. And when you look at our 2 histories alone, we have 58 years of clinical experience.
Goodness, that's a long time.
Yes.
Lots of experience.
Well, 38 years of clinical experience as a CHT.
Right.
And then with an addition of our occupational therapy assistant, combined with the 2 CHTs, we have 58 years of clinical experience.
Yeah, and so, you might be better at things than he is, or he might have an upper hand on you, but you guys can get together and work and figure it out.
Yes, we work very closely together. Our room is small enough that we can kind of have a very informal but professional atmosphere, and
Good.
we're able to interact with each other and with our patients. And we're always giving helpful hints to each other, able to learn from each other. So it's a very friendly, welcoming environment to be a part of.
Well, tell me about the facility at Bradley Whiteside Rehabilitation.
Sure. We are located at 1225 Broderick Drive in Dalton, and in our facility we house both physical and occupational therapy services. We really pride ourselves on trying to concentrate in providing one-on-one care. That's not something that you're going to get in many therapy facilities. And then also our typical treatments may vary between 30 minutes and an hour, and again, that time is more determined by your needs and what we actually need to address in the therapy sessions. Right. We are open Monday through Friday with typical hours from 7:30 to 6, Monday through Thursday, and then 8 to 4:30 on Fridays. We are lucky to have a heated pool and also weight machines that we can use through the Bradley Wellness Center. So those are kind of bonuses with coming to our facility, again, that you may not find at other facilities. We do have several specialty areas that we are able to provide to patients. In addition to the hand therapy that we've talked about today, we also have lymphedema services, we have vestibular rehab, and also we have a pediatric program, dry needling therapy, Parkinson's big therapy.
Yes.
And overall just use of aquatic therapy for our low back pain patients.
If I'm having pain or if I'm having problems using my arm or my hand, what do I need to do to be able to come and have hand therapy with you?
First of all, you just need to obtain a physician's order, and that can be from your primary care physician or an orthopedist or a neurologist that you may be seeing. It doesn't really matter where the order actually comes from, and then you would simply call our facility to set up that appointment.
Well, that is great. Thank you so much for joining us. I have learned so much. I didn't know much about rehabilitation for your hand, and that's great.
And we are happy to help anybody in any way that we can.
That is fantastic. Thank you for joining us today. For more information about Bradley Whiteside Rehabilitation, visit hamiltonhealth.com/rehab or call 706-272-6199. 706-272-6199. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.